Criminology Board Exam Reviewer. Forensic Medicine. Definition of terms. Part 6. Necrophilia. It is the sexual intercourse with dead body. Necrophilus. It means having a dietary fondness for dead flesh. Necrosis. It is the death of one or more cells or a portion of a tissue or organ. Neoplasm. It is a new and abnormal formation of tissue such as a tumor or growth. Neuropathy. It is a disorder of the nervous system, in contemporary usage, a disease involving the cranial or spinal nerves. Neuroses. It is when the patient suffers from emotional or intellectual disorder but does not lose touch with reality. Osteoarthritis. It is the deterioration in joint integrity connected with use where exacerbated by inflammation and related to reduction in bone density. Osteomyelitis. It is the inflammation of the bone, especially the marrow, caused by a pathogenic organism. Osteoporosis. It is the increased porosity of the bone, seen most often in the elderly. Pedophile. He is an adult who repeatedly engages in sexual activities with children below the age of puberty. Paraphilius. It is the abnormal and unorthodox sex play using unusual objects or parts of the body. Perimortem. It means at or near the time of death. Pataschi. These are pinhead-sized, red dots which are minute hemorrhages found inside the eyelids and the facial skin, considered by pathologists to be a sign of strangulation. Phobia. It is an excessive or irrational fear of a particular object or situation. Plasma. The liquid portion of whole blood containing water, electrolytes, glucose, fats, proteins, and gases. Contains all the clotting factors necessary for coagulation but in an inactive form. Once coagulation occurs, the fluid is converted to serum. Pneumonitis. It is the inflammation of the lungs. Post-mortem. It means after death, occurring after death, or pertaining to a post-mortem examination, an autopsy. Post-mortem. It is the alteration to the body that occurs after death that is not related to ante-mortem injury. Post-mortem. It is the period of time between death and corpse discovery. Priapism. It is a painful penile erection in absence of sexual desire. Pseudomalingering. It is a phenomenon whereby a mentally ill individual feigns the mental illness he or she actually has. The behavior is considered a temporary ego-supportive device that allows the individual to feel he or she has control over the illness. Psychological autopsy. It is an attempt to determine the mode of death, whether an accident, suicide, homicide, or natural causes, by an examination of what was known all about the deceased. Psychopath. He is a person who is neither insane nor mentally defective but fails to conform to normal standards of behavior. Psychoses. They are characterized by withdrawal from reality, living in a world of fantasy. Pulmonary edema. It is the accumulation of extravascular fluid in the lungs that impairs gas exchange, usually due to either increased intravascular pressure or increased permeability of the pulmonary capillaries. Putrefaction. It is the foul-smelling, anaerobic decomposition of moist or wet organic matter by microorganisms. The breakdown of tissues, particularly proteins, due to enzyme action. Pyromania. It is the sexual stimulation while seeing flames or destruction of buildings. Rigor mortis. It is the stiffness of the body after death that helps in reconstructing the time at which death occurred. The progressive rigidity of a corpse following death, caused by an accumulation of lactic acid in dying muscle tissues. This is a temporary condition lasting 12 to 36 hours. Sadism. It means that sexual gratification is obtained or increased from acts of physical cruelty or causing of pain upon one's partner. The term is derived from the name of a French nobleman, Marquis de Sade, infamous for his crimes and writings. Many of his stories were about sexuality, cruelty, and torture. Saponification. It is the conversion of corpse body fat into a curd-like foul-smelling product called adiposia.